The CDC's Vaccine Advisory Panel will meet today and tomorrow to decide what are the change recommendations for vaccinations. So this comes after Health Secretary Robert F. Kennedy Jr. fired the CDC's director last month and then replaced the entire Vaccine Advisory Panel with allies, including some who've voiced anti-vax views. Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security, joins us live now. Dr. Adalja, thank you so much. We've been hearing repeatedly that some career scientists are concerned with the new panel. Can you explain those concerns?
The concerns stem from the fact that the vast majority of that panel, with probably only one exception, are not qualified to be on that panel. These are individuals who have a track record of engaging in anti-vaccine propaganda. These are individuals who have been opposed to vaccines, who don't see value in vaccines. And they were handpicked by RFK Jr., who himself is an anti-vaccine advocate. So if you're a serious vaccine scientist, you should be very scared about that panel, because that panel has power, and that panel is completely impervious to the power of science or understanding science or using rationality and logic. So it is a very dangerous precedent when you have that group of individuals endowed with so much power by RFK Jr.
So how could changes to the current vaccine schedule then impact public health?
Well, the vaccine schedule is how we vaccinate children, how we vaccinate adults, how we control many communicable diseases. So when you change that carefully calibrated and vetted and evidence-based schedule, you are going to open up opportunities for pathogens like measles, pathogens like pertussis, pathogens like influenza and COVID and others to spread. Hepatitis B is another one that is a focus of this panel. So when that schedule is scrambled and people aren't getting vaccinated at the numbers necessary to keep these things at bay, that allows those pathogens to take hold again. And then you have vaccine preventable cases, hospitalizations, emergency department visits, and deaths. Remember, 3 people died of measles this year in the United States.
So we've seen a number of medical bodies, like the American Academy of Pediatrics, differing from Secretary Kennedy on vaccine guidance. So we're hearing all these differing opinions and research. So what should people do if they want to get advice and if they don't trust the panel? Where do they go?
Well, the first thing is to talk to your primary care physician. They are usually a good person to run these things by. But there are other groups, such as the American Academy of Pediatrics, which has always put out its own vaccination schedule. It had been harmonized with CDC for decades, but now it's going to differ. That schedule is one that I believe in. The American Academy of Family Medicine also has their own schedule for adults. The Infectious Disease Society of America and other organizations are going to be coming out with their own vaccine schedules. So there are going to be alternative sources that are more evidence-based, more driven by the scientific process than what's coming from ACIP. I myself don't trust ACIP in what comes out of that committee.
Dr. Amesh Adalja, thank you so much.